how and the where really aren't all that important. But I'll tell you what is important: your health. I'm your bosom buddy, and I'm here to help by answering any questions you might have regarding your breast biopsy.
Wow, well, you've come at the right time because I'm going in for a biopsy today and I have lots of questions about the procedure. The biggest one being, do I have cancer?
The imaging tests that you've had have shown an abnormality. The only way to definitively know what that abnormality represents is to do a biopsy. That will screen for signs of precancer or cancer. But the majority of women who have a biopsy don't end up having cancer.
What's actually involved in the procedure? Who performs it?
A radiologist will do the biopsy. A radiologist is a doctor who specializes in medical imaging. They'll use ultrasound or mammogram to accurately guide the biopsy needle. A mammography or ultrasound technologist will help the radiologist during the procedure. Let's ask the radiologist to elaborate a little more on what you can expect.
Hi there, my name is Jillian Faberway and I'm a radiologist. A radiologist is a medical doctor that specializes in the interpretation of different imaging tests such as x-rays, ultrasound, as well as mammography. I understand that you're here for a breast biopsy today. Breast biopsies are done with the help of an imaging technologist. We can either do breast biopsies under ultrasound guidance or under mammogram guidance. Both of these procedures help us guide our needle into the lump or the abnormality that was detected on your imaging tests. For ultrasound, you will be lying on a stretcher throughout the procedure and you'll be quite comfortable. For the mammogram procedure, you'll be sitting in a special chair and your breasts will have to be in a small amount of compression throughout the procedure. Both of these tests enable us to get an accurate biopsy and give us an answer to what we have found on your imaging tests. These tests are both tolerated quite well by women, and most people tell me they weren't as nearly as bad as they expected.
Will I have to be knocked out, gassed, or am I awake during this?
You'll be awake and alert for the biopsy procedure. The doctor will use local freezing to numb the area. It's similar to the freezing that you would get at the dentist's office.
I think I'd rather visit the dentist.
Aren't you the active one?
Is it a long procedure?
It takes about an hour. Most of that is preparation. The procedure itself actually only takes about 5 or 10 minutes.
Afterwards, is there any scarring left or pain?
After the biopsy, you'll have a bruise at the site for a few days. The area of the biopsy will be tender, and it'll heal just like a bruise.
Will I be able to get back to my regular activities immediately following the procedure?
We do recommend that you have somebody available to drive you home afterwards, because we've found that some of our patients feel a little queasy after the biopsy. But most women get back to their normal routine the next day.
Oh, will I get my results when it's done?
It takes about a week for the lab to process the tissue specimen and get the results to your doctor. Oh, you should contact your doctor's office for your follow-up appointment.
Thank you. You've been really helpful.
My pleasure.